Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
The outbreak of COVID-19 has forced governments worldwide to make critical choices to especially support health systems that are dealing with large numbers of sick people. This has a direct impact on the global budget for health, but will affect those with weak systems greatly and may derail their efforts towards meeting global targets like universal health coverage. Good health systems are rooted in the communities they serve. They focus not only on preventing and treating diseases and illnesses, but also on helping to improve well-being and quality of life. In Uganda, village health teams or community health workers play this role. Living Goods, an international organization that works to support community health workers through the health ministry, is now providing essential medicines and other protective equipment to enable them stay at work. Prosi Muyingo and her colleagues are still working, but the conditions have definitely changed.
Before COVID-19 lockdown, I used it to go door to door, educating my community about health, immunization, treating children under 5 for malaria, pneumonia, and diarrhea. I also used it to give antenatal and postnatal care to mothers.
They have now included COVID-19 on their routine community lessons.
I was given PPE such as masks, gloves, and sanitizers to use when distributing posters to sensitize the community about COVID-19.
In 19 districts, so 4,200 community health workers are fully equipped. So essential medicines for VHCs, as per the national guidelines, are ACTs to treat malaria, or amoxicillin to treat pneumonia, and ORS and zinc to treat diarrhea, as well as paracetamol to really manage fever.
Globally, the World Health Organization has advised countries to ensure that emphasis on other diseases does not diminish, which explains the relationship between COVID-19 and diseases like malaria.
COVID and malaria present with similar features. They all have fever, they have body weaknesses, they could all have chest complications. If we are supposed to save and reserve our health resources for fighting COVID, it is important that malaria is prevented. And in any case, if people get it, it is very difficult for them to go to seek care because they are on a lockdown. And we have, accordingly, as part of sustaining essential services, we have tried to make malaria treatment more available at the community level through VHTs, both private and public. But when you are admitted, also you risk getting COVID to you within the facilities.
And to achieve universal health coverage, primary health care is key.
There are people who are following up this, but obviously now we have this threat in the house that we need to respond to, and we must ensure that the population keep alive, even as we continue tracking all the other basic health services that need to be offered to the population.
Associate Professor Freddie Sengoba, a health policy analyst and researcher, says this outbreak will dent several aspects of universal health coverage for Uganda, including services like prevention, diagnosis and treatment of diseases, so that people can realize their right to health, which is a fundamental human right.
COVID has come literally to, in the short term, I believe, or I hope, to try and create major access problems, especially for the routine healthcare. As you know, the lockdown is stopping many things, including public transport, or being stopped. There is curfew, meaning people should not move at night. And of course, there have been media stories of how those that try to find themselves trying to go to seek care have been in one way or the other handled by security forces in a way that will scare everyone from venturing to go to the health system. But the public transport itself stops sometimes the health workers themselves to show up, as well as the patients themselves to move. Health systems, especially in other countries, having health workers themselves exposed to this COVID, and some people may fear even to come to see health workers, fearing that they may actually contract COVID-19 from the hospitals and health centers. And in the short term, we are actually seeing a major decline in the numbers of people coming to deliver in health facilities. And here we are hoping they are delivering in their homes. The people who are supposed to be initiated on treatment, either for HIV or TB or other chronic conditions, have also declined, meaning that most of them are getting these infections, but they are not yet being identified and put on treatment.
Uganda is a signatory to the Abuja Declaration, where African Union countries pledged to commit 15% of their budgets to improving the health sector. For close to 2 decades, Uganda has not met this target and has had a sizable chunk of the health budget financed by donations. This will have a major impact, as Dr. Sengoba explains.
The health sector, I must say that some funds have been earmarked to help expand the response to COVID. And of course, some of this money may necessarily be money taken away from what the health system do every day. And that might mean that some drugs may not be available. So I don't know whether 40% of this kind of support we've been getting to run the system is going to come, and how, if it doesn't come, how we can plug that gap, because we've been very much reliant on donor aid, and all the countries that give us aid are now really on their knees.
COVID-19 has provided a good platform for enhancing public health. It has provided for us a platform to sustain some of the gains that we need regarding public health, and I do hope that the population will maintain some of the measures that we are learning now, especially hygiene, social distancing, because this will largely contribute to some of the activities that we have to perform towards universal health coverage.
I believe the biggest lesson we've learned from COVID is how to identify those things that threaten our survival as Ugandans and be able to do them at home, irrespective of how cheap they might be done outside.
COVID-19 will directly or indirectly affect everyone, everywhere, and in reminding world leaders how their universal healthcare coverage commitments can guide action during this global emergency. Walter Mwesigye, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities